sticking in my face. Do you get what I mean?
Kwame, it's 10 years.
Oh! Wait, Medicast is 10 years!
Hooray!
Wow!
Kwame, tomorrow is 10 years since we took that bold step.
Wow!
To
you
to make a
deserve
difference.
round of applause.
You
This is
know.
for the Medicast team.
Yo. Yes,
10 years.
Tomorrow, 18 September.
That's amazing.
When we took that bold step, when we officially commissioned, we started work, trying to make a difference in the healthcare space, because there's so much that needs doing, particularly in that healthcare sector. I've had the privilege of traveling around this country quite a bit, so most regions. And then also, Kwame, if you keep looking at our health report that comes across, we've got huge challenges. And I remember the first step I took, or decision I took to contribute, was not to brain drain. So, Kwame, I've stayed here since I graduated. Of course, having to go out every now and then for some training. But
you always make sure you're back here.
Exactly, so to contribute. But then at a point I felt that doing it through Medicast gives me the opportunity to impact the way that I wanted to. And it's been 10 years. It's been like a roller coaster. It's been very, very rewarding, but I can tell you that the future excites me more than the past.
Look, this is great, and we're actually happy to have been part of the journey for probably a bigger chunk of the 10. 8 years.
8 years. So
wow, this is great.
We've been going. Thank you very much.
God has been good.
Yes, through Joy FM and through this show, got to meet so many different people. And I always say that I like coming. I like Wednesdays because it's a different day.
Yeah.
From the consulting room, the ward, and the lab.
Yeah.
The theater, the morgue. It's different. So
yeah.
When we come here, then it's work, but
this is a different consulting room for you.
A different
a more relaxed one.
Yes, I get to meet Philip.
Trouble.
Okay. I didn't want to leak that one out.
Anyway,
right,
we're happy you're here. And today you want to take us into the laboratory.
Yes, today we are spending some time in the lab, the medical laboratory.
Okay.
And my area of specialty is chemical pathology. I'm a diagnostician. I spend a lot of my time doing diagnostic medicine, meaning I try and understand what is wrong with people. It's only when you understand what is wrong that you can treat and treat well. So chemical pathology deals with the biochemical changes that happen in the body. So we do a lot of tests.
Okay.
And the way the world is also moving, and also the shifting from clinical signs and symptoms to what we call the evidence-based paradigm, we're running more and more tests, and you have to. So I really understand how the test works, what the limitations for each test is, and what insight you can gain from every test. And I tell you, that is where I answer a lot of questions. People will ask me a question. It would be that, oh, I went here and I did these tests. Can you explain? So I was like, okay. Today, why don't I take people into the laboratory and then, or let's see what the utility of some of the commonly requested tests. And from the three that I've picked out, I'm sure everyone listening would have done one of these in their life at some point. So, Kwame, let's start with one of them.
One of the tests?
Yes. Well, which one do you want us to start with? There are three of them.
Pregnancy test.
No, that was Philip's favorite test so many years ago. But
okay. So we can start
let's
with
start with the urine. Okay.
The urine test.
Now let me tell you a funny story. Well, it's a very serious story, but it's funny as well. Kwame, we used to do this entry school medical exams. It was an all-female school, tertiary. Or should I say quasi? Oh no, tertiary. Yeah, now tertiary. Right, all-female, religious. So, as part of the medical screening, one of the things we decided to do is to do what we call a urinalysis, a urine analysis. It's one of the commonly, performed tests. Only for us to be hinted about 3 hours into the thing that something funny is happening outside. And we got closer and we realized that one person out of a group pees and then they share the urine into everybody's container and then they submit it. Oh, but this one, we're doing tests for every individual. The students thought that we were doing urine pregnancy test. So wow, what do you clean? Yes.
Oh my
Then
God.
they take the urine sample from that person, so she'll pee quite a significant amount, and then we'll put it
Oh my
and
goodness.
then they will bring it. So that if they know it to be negative, then it's negative for all of them. Not knowing that was not what we were checking, but we were looking, or we look at the urine, or we do a urinalysis, and it gives us, if you like, a bird's eye view of the state of health, of a human being. So let's go into that. This was about 4 or 5 years ago. They've all graduated and they are all big women somewhere right now. So maybe some of them are even listening. If you're part of that squad,
Please confess.
Send us a hi.
Confess.
So Kwame, urine is formed when blood goes through the kidney or is filtered through the kidney. So the kidney has, if you like, a filtration system, and blood runs through it and the kidney filters it. And that filtration system works such that the kidney would keep all the good things in the blood and then let out the waste and excess stuff that it doesn't, or the stuff that it doesn't need. All right, we'll let it out. So that's basic principle for how that filtration system within the kidney, works. So Kwame, if you look at it, there are about 15 different parameters. When we look at the urine. So let's quickly run through some of them. What's the first
thing
one?
that I see is appearance.
Yes, the appearance of the urine. So that physical examination, the moment you give us a container of urine, we do a physical examination and we just look at how it appears. And
when you say how it appears, what do you mean?
Yeah, I mean how it looks like to you visually on visual inspection.
Okay.
All right.
So this sample that we have here,
right,
on this sheet test that you did of
right,
the person, says the appearance is cloudy.
Yes.
Okay.
So it's cloudy. So it looks like you have clear water and then you just take a drop of milk or something.
Yeah.
1 drop of milk into very clear bottle of water. It gives you that kind of appearance. All right. Kwame, the moment I see that, I know the patient has a urinary tract infection, that you've got germs in the urine.
Okay.
All right. So that is one of the first things that we point out. But we cannot run through all of them, so I'm just going to jump to some of the things.
But hold on. Before you jump, so if a cloudy appearance means there's a problem.
Yes, it's an infection. It's likely that there's an infection.
Okay.
In the urine.
What will signify that this is healthy? Is it clear or pale or what?
Yeah, it has to be clear. It has to be transparent. Yeah, all right. You have to be able to look through to the end. If you put a newspaper at the other side of the container, you have to be able to look through it.
Okay. What about color?
It's right. So color does matter. All right. And the color of the urine, especially people have come and then they will say a lot of different things. But I mean, there's a range, of colors that the urine can take on, or particular shade, if I put it that way, of we usually describe it as amber. But Kwame, there's also straw. I'm sure somebody's thinking, what's amber? The traffic light. If that color, all right, that shows up, it's amber, all right. But you can also have straw. Kwame, the keteno.
Yeah.
Not this Gen Z kete.
No. The straw mat.
The straw mat. That one. So when we talk about straw, we're talking about that shade.
Okay.
That shade of it. Philip is very familiar with that. No Junso Gusupa. No Wakwako Hata.
Junso Krobo.
Yes.
Isn't that what is it? Krobo?
Junso Krobo. Yes. Then he goes to dry it. So you can have that. Sometimes we do procedures, or sometimes people eat things like beetroot.
Yes.
For example, and then it would stain the urine and give it a color as if there's blood in there. Oh, okay, there you go. So you the audience, yes, Lexus has a drink of beetroot, so his urine is going to look like beetroot at some point today. Probably it's going to happen at night or at dawn, so he wouldn't see it. But that's exactly.
I'll look out for it.
Yes. All right, but Kwame, if you haven't taken in beetroot and the color of your urine looks like that, they would call that hematuria. All right, blood in the urine.
Okay.
Or to suggest to us that there is blood in the urine.
Okay.
And if there's blood in the urine, then we're thinking about disease that could be originating in the kidneys, could be coming from the ureters, could be coming from the bladder. It could be a stone, all right, a kidney stone. It could be something we used to call bilharzia, all right, which is an infestation with an organism called schistosoma. So it could be cancer, it could be bladder cancer. So when you see, just by the color of the urine, if it is bloody in color, we start making a whole lot of diagnosis. When we think about it, how easy is it to get urine? We just give you a container, you go into the washroom, and you just let it out. All right? So no need for needles or anything. So this specimen is so easy to collect. All right? And it gives us a great deal of information. What's the next one?
Glucose.
Yep, glucose. Sweet tasting urine. And I've shared this before in the studio, that many years ago, the pioneers of my discipline, chemical pathology, they had to taste the urine. Doctors also had to taste the urine at the diabetic clinic. Oh. We have suffered before, So glucose is sweet tasting. Unfortunately, that is why people still call it sugar. All right, it's not sugar, is sucrose, but glucose is also sweet tasting, and you should not have glucose in your urine. If you have glucose in your urine and your urine tastes sweet, and we do a very simple dipstick test on the urine, it's reported either as 1+, 2+, 3+, and 4+. So this particular patient example I'm showing to you, you can see that it's 4+ of urine, and therefore it is very likely this person has diabetes.
Really?
Yes.
What is that normal rate?
So we're not supposed to have glucose in your urine.
It's supposed to be 0.
Exactly.
Okay.
Or trace amount. So report it either as negative or trace amount. All right. It is only when the blood glucose level crosses a certain threshold that you get a spillover in the urine.
Oh.
All right. So if we start finding it in the urine, then we trace our steps back. Most likely your blood glucose is more than 10 millimoles per liter. And the cutoff for diagnosing diabetes is 7.
Wow.
So all these things are suggestive. They are not firm diagnosis, but it starts to take you in a certain direction.
Okay, so it means that the normal healthy human being is not supposed to have sugar in their urine.
Glucose.
Yeah.
Yes. No glucose in their urine.
What about sugar daddies?
Kwame, let's continue.
Okay, sure. Sorry.
Right. So Kwame, I'll pick something we call the pus cells.
Pus cells. PUS.
Pus cells. Yes, PUS. Pus cells. If you're going way down there,
I've seen it.
You would see greater than 30.
Yes.
So the pus cells, again, represent, if you like, the police of your urine stream or in the urinary tract, the police in the urinary tract of your anatomy. So what do the police do? They patrol, and they make sure that nobody is infringing the law, and society is operating peacefully. All right. So if you ever get an infection, the number of pus cells would go through the roof. So ordinarily, if there's nothing happening in this country, you just find a few policemen in town. But I remember my by-election here. All of a sudden, plenty police people. Why? And because they know there's going to be trouble. Sadly, there's going to be trouble. So anytime we see pus cells beyond 5 for men or boys, or beyond 10 for girls or females, then again it will suggest to us that this person has an infection. When you start going beyond 30, we stop counting because it's an overwhelming infection.
Okay.
So if you look at the appearance, even before we put the urine under a microscope, it was cloudy.
Yes.
Then when we put it under the microscope, we saw lots and lots of pus cells greater than 30. And then you are getting further and better particulars to support your diagnosis of a urinary tract infection.
Okay.
So this particular patient that we are looking at has most likely is diabetic because we've seen glucose 4 pluses. Most likely has a terrible urinary tract infection, which wouldn't surprise me in a diabetic as well.
Really?
Yes, because one of the things diabetes poorly controlled does to you is that it takes your defenses down. It makes you almost defenseless. So it hits your immune system and weakens it. And therefore, you're at risk of developing, infections. So Kwame, you see how we sort of like weave it all together with a very, very simple, test. So this is just some insight into what we can glean from, say, a urinary tract infection. All right. If the infection keeps getting worse, then certain chemical substances like ketones. So Kwame, I'm sure you've heard of this ketogenic diet.
Right.
Right. So I always say that in as much as on the face of it, it gives great results because people lose a lot of weight in a short period of time. Biochemically, from where I sit, it is a dangerous way to lose weight. Biochemically, so many changes happen in your blood, and you begin to produce ketones because you are falling. You don't have any glucose. You're not taking any glucose in your diet. You're falling on proteins, and your body starts to use proteins and then fat for energy production. And when that happens, you produce a byproduct called ketone bodies, and then these ketone bodies change the pH of your body, and then we also begin to see them spill over in the urine. We get to see this kind of picture in people with severe diabetes, which is a disease we call hunger in the midst of plentiful. So you have to be careful with that ketogenic diet. So Kwame, if ever your doctor requests a urine examination, there are a whole host of things that he is looking to understand from it. And for the females who are listening, it is not always that when we ask for the urine, we want to know about pregnancy.
Okay, well that's a lot of relief.
Yeah.
Yeah.
Right. So Kwame, let's look at the next test, which everybody has had before in their life. Everybody, not just some people. And that is the full blood count.
The full blood count. Okay.
The full blood count.
What is that seeking?
Right. So Kwame, again, when we take a blood sample, we can run like 1,000 different tests. But the full blood count specifically looks at the 3 main cell lines that we have, the cells that you have in your blood. So Kwame, we are made up of white blood cells, WBCs, red blood cells, RBCs, and then something we call platelets, PLT, on the sheet that you have in front of you. Right. So what do the white blood cells do for us? Well, I mean, the white blood cells protect us and fight infections, and there are different types of it. Well, I mean, think about the Ghana Armed Forces. Typically, they are made up of what? The Ghana Army, the Ghana Navy, and then the Ghana Air Force, right? But if you put all three together, then you have the Ghana Armed Forces, all right? So when it comes to the white blood cells too, there's a similar classification. We break them into different groups depending on the kind of warfare they undertake. If you're fighting on the ground, for example, and that would be the Ghana Army. So you have the first group, we call them the neutrophils. They fight bacteria. So anytime you get a bacterial infection, it is that type of white cells that would shoot up. Your body sort of like mobilizes a lot of them to fight. If you get a viral infection, you don't need neutrophils, because there's something on the sea we'll call the Ghana Navy. All right. So your body will then will mobilize and deploy the lymphocytes. And then for all other types of infections, this particular analyzer that we use, it brings all other types of infection together. But Kwame, I'll tell you, 80% of all the infections to 90% of all the infections that we see in the hospitals are usually either bacteria or viral. All right. Think about getting a runny nose, sore throat. Most likely it's a viral infection. Think of getting a boil. Most likely it's a bacterial infection. And like the earlier results that we saw, it was a bacterial infection in the urine. So if it was that same patient and we asked for a full blood count just to firm up our diagnosis, I would expect the white cell count to go up. All right. So the white cell count, depending on your race and then your age, there is a limit. Well, before adult males, African origin, we will put it around 12. So if you look at the result in front of you, that's 18.
Yes.
All right, 18. So 18 means that it is elevated. You've gone above what the upper limit, and therefore it will signify to us that it's an infection. Then we'll go through and then we'll look at what type of cell line, white cell, is elevated. In this instance, it was a bacterial infection, all right, because it was a neutrophils that's gone high to 15 with an upper limit of 8. So just this simple test helps us. Although we don't know the name of the bacteria, we can't tell you much about it. The doctor just knows from looking at these labs that it has gone up. But I mean, the white cells also can tell us about certain diseases we call leukemia and then also lymphoma. Many years ago, multimedia helped us promote leukemia. There was the Danny White Foundation. There was a young man.
Yeah, Danny White.
Yes,
Danny.
Exactly. I was in med school at the time, so this was many years ago, and he came to Ghana, and I think we got to know a lot about leukemia. So it's a disorderly maturation of white cells. All right, so your whole blood gets filled up with too many white cells, and it is not just like an infection, but too many abnormal looking white cells, and that gives you a problem. They cannot fight and fight well, and we would make a diagnosis of, say, leukemia from it, and your doctor can get insight from just this. So very important diagnosis can be made from your full blood count. Now the next is the red blood cells. Well, I mean, the red blood cells is actually what gives your tongue, your inner lips, your nail bed, and then your conjunctiva, the redness. So most of the time you go to the hospital, one of the common physical examination you would get is a doctor, prying underneath your eyes and trying to expose, your conjunctiva to assess how pink it is, or how red it is. We look at your nail bed and we even look at your palms. All right. And now you have trillions. The average red cell count is between 5 and 5.5 trillion. So you have so many red cells in your blood. And red cells are very important because they carry oxygen around the body. All right. So Kwame, most of the time, the red cells are able to do this because they contain a pigment we call HB, hemoglobin. All right. And this hemoglobin carries oxygen around our body. And that's why every time they are doing the World Athletic Championships and then the Olympic Games, Kwame, have you seen any West African attempting the 1,005 5,000, 10,000, or marathon. It's always those people who live in the highlands of Uganda, Kenya, East Africa, and then Morocco and all of that.
Ethiopia.
Yes, because they have higher than normal levels of red cells, and the hemoglobin. So their oxygen carrying capacity is higher. All right, they call it the natural doping. Because they live at altitudes, greater altitudes, the oxygen is thin. Your body tries to compensate by producing a lot more red blood cells. And so if you keep training at altitude, so my favorite is Faith Kipyegon, 1,500.
Yeah.
She won it yesterday too, for the 4th time. She's been running bare feet to school since she was a kid. Now, when West Africa national, don't forget it. It's all happening unless you go live there and then you run. So that is how we sometimes say that somebody has blood or somebody doesn't have enough blood. All right, we look at the red cell count or we look at the HB.
Okay.
But I always say that the red cell count is like money. Too much of it, not good. If you don't have enough money to, not good.
No, give me too much.
Open too much, no. Right. So your red cells, if you have too much red cells or too many red cells, meaning your HB is higher than normal. And let me use men for example. The maximum HB is 17. All right. If you have more than 17, you clog up your blood vessels, and you will suffer a stroke.
Okay.
So sometimes people suffer a stroke. It's not because of hypertension, not because they're diabetic, but because they have too many red blood cells floating around, clogging up their blood vessels, a situation we call polycythemia. Polycythemia. It's too many red cells. Well, if you don't have enough as well, then we'll call it anemia. Well, then in the past, people go and drink Guinness. Because Guinness is dark, it's Mojedru. They used to sell it. I heard they used to sell it, Guinness, in the community pharmacy. So when they started.
Oh, yeah?
That's not about it. I don't know whether that's true.
Michael Power.
But yeah, Michael Power. Because it's so dark, we think it's Mojedru. So iron is dark colored. So a lot of the hematinics that we serve in hospitals, yeah, they are dark colored preparations. So if you don't have enough, then your doctor would say anemia. And then the doctor would do further investigations to understand the type of anemia. Then the last cell line is what we call the platelet. I mean, if you have a cut and you put a little pressure on it, the bleeding stops.
Yeah.
Exactly. You are in the kitchen. You are trying to do something. It's not there. And then you are trying to do some things like you know how to cook. Meanwhile, because you happen anemia. Then the kitchen knife cuts you. You put some pressure on it, then it stops. The platelets actually help to make plugs that will plug the blood vessels. It's just like you have a bicycle puncture, tire puncture, and you try and plug that puncture with a sticky thing to prevent the air from leaking out. That's the job of the platelets. All right. Okay. So again, if you have too many platelets, not good. If you don't have enough of it too, then you get these episodes of spontaneous bleeding.
Okay.
Somebody will have a nosebleed. Wakes up in the morning and there's blood on the pillow. Nobody's punched you in the face. Your doctor will do a full blood count because he's interested in the platelet.
No, this is very good information, eh? Wow. I mean, we get all these tests and then we just bring it over to you because we don't know what it means. But now, at least, we get to understand what you're looking for.
Exactly. And that's the whole point, because I get people pop a lot of questions, and I guess probably the doctor doesn't have 20, 30 minutes as we've just, done to try and explain all of these things. So sometimes we are very quick about it. Yeah. And so, your blood level is down, let me do this. And then we probably would have asked for about 3 blood tests. So you don't really know which one is for which. So today, at least, we know about the full blood count and what it does, and then also the urinalysis.
Thank you, Doc. Right. For those who want to reach out to you, how can they call you? Right.
So if you want to come by Medicas Hospital, first call us 0501 477 340. Our WhatsApp number is 0501 477 340.
Doc.
Yes.
Ray if you.
I can be ready if you. 0501 477 340. White blood cells I be blue with you. Or you can come by number 10 Kincho Street at our East Legon Hills branch.
That's right.
man.
0501 477 340. Send us a WhatsApp and we can help you do any of these tests.
Okay.
Kwame, it's still Blue September. Let us not forget, it's still Blue September.
Great stuff. And please call Doc and wish him a happy anniversary as well on the number. Yeah,
yes.
The team at Medicas are 10 years this year.
Years.
So congrats again. Yeah.
Thank you, Kwame. Thank you. Come in for your prostate check. Everybody.
Yeah, the prostate checks, very important. Stay tuned into Joy 99.7 FM. There's more after this.
Man, have you received the delivery?
See, the rider's bay. Send in the momo.